An investigation is underway into why a Rockhampton nurse who's been diagnosed with COVID-19 went to work after she'd been tested. The facility is in lockdown and nearly 200 people she came into contact with, including residents, staff and members of the community, have tested negative. With no more cases, the focus has shifted to how the situation happened.
It's the coronavirus case that's demanded an emergency response.
All 193 tests have returned negative, which of course is the best we could have hoped for.
A nurse worked at the North Rockhampton Nursing Centre, sick for more than a week and also awaiting her test, all against the direction of Queensland Health.
All of our staff are entitled to pandemic leave, and so there is no reason why they would not be able to take the time that they need to be quarantined.
The 115-bed facility and its residents have been locked down, while authorities establish how the case slipped through on-site screening measures.
There was a requirement for that to be in place across all of our aged care facilities and indeed all our healthcare facilities. So we're trying to work out what happened there.
The Nurses Union says short staffing is unlikely to have been a factor, but that it will be determined by the investigation.
Staffing at North Rocky has been, well, I won't say perfect, but it has been certainly adequate over the time.
Some residents are now being relocated to local private hospitals to limit possible spread of the disease. Kathy Garvey's 95-year-old mother, who has dementia, lives in the wing where the nurse worked. She learned about the case through the media.
I was watching ABC 24 News and I saw it come up on there.
She is in isolation, awaiting her own coronavirus test result after visiting on Thursday.
I feel well and my temperature's been 35 for the last 4 tests I've had over the last couple of weeks. So, yeah, no, I'm not worried.
It's the first case Rockhampton has seen for 7 weeks, just as restrictions are being eased across the state.
We had a function and a booking for breakfast, but that was cancelled due to, that family had to be in isolation.
As part of its rapid response plan, Queensland Health has opened a second fever clinic in Rockhampton to meet increased testing demand. The nurse was contagious for more than a week before she was tested, and extensive contact tracing is underway, with the community being urged to get tested for even mild symptoms.
We need to make sure that we've learnt the lesson from this particular event and that now is corrected and we don't have a similar situation anywhere else in our state. That's critical.
A troubling situation that could have been much worse. Jemima Burt, ABC News, Rockhampton.